About this and everything else. Dr. Murphy, professor of infectious diseases at Northwestern University Feinberg School of Medicine. Dr. Murphy, good to see you.
Good morning.
So let's talk about this vaccine trial. This is a new one at University of Chicago, and talk about where we are with all the vaccines in general. We have one that's ahead of others.
Yeah. Well, there's 140 vaccines in development. There's at least 8 of them that are in the last phase of their development. So we call phase 3. So both the University of Illinois, Chicago, University of Chicago, and Northwestern are all testing vaccines, are testing different ones. So this one that University of Chicago is going to test, very interesting one. They're all a little bit different, by the way, and they're most likely going to have different kind of results. The kind of favorable thing about the one down at U of C, this Janssen J&J one, is that the refrigeration requirements are much less than many of the other ones. And this one is 1 dose with no booster.
We set a record last week for children getting COVID, 61,000 children. In the early stages, it was believed maybe they were in a high risk, but what are we learning about this?
Well, they can get it just like anybody else. But they typically have mild disease, but that's just typically. Still, 121 kids have died from COVID, and the hospitals have children there. So the fact that people say, oh, the kids don't get it, it's very mild. Yeah, it's very mild if you don't end up in the hospital and dying.
Let's talk about pregnant women. Now hearing they're a higher risk.
Pregnant women? Yes. Pregnant women are at increased risk of having a complication. Like they had an underlying disease, like diabetes or something like that. The risk is increased, but it's not an exponential increase. It's an increase by a few more percent of having this complication or that complication. They tend to have more preterm deliveries, which is a risk. They end up in the ICU a little bit more. The death rate is a little bit more, but it's an incremental increase. If a woman is pregnant, she needs to be followed in a high-risk pregnancy group.
All right, let's get to viewer questions. The CDC states if you get a negative COVID test after being exposed by someone, that it could be that the sample was collected too early after exposure. When should someone get tested after exposure? When is someone contagious?
This is a great question. We sort of have the answer. In the first couple of days, the test is going to be negative no matter what test you do. After 3 or 4 days, the chance that the test is positive increases. So by 5 days, if you're going to be positive, you're positive.
All right. College student will be home from mid-November through mid-January. What are the steps we should take to transition from dorm pickup to back to normal behaviors and interactions in our home?
Well, a lot of it depends on the college they were at and how much COVID was going on at that college. So, not every student is the same. However, the students, it's not like they're getting it in the classroom. They're getting it when they socialize outside of the classroom and typically now off campus. So to be extra safe, you send the kid to the basement for a couple of days, and like I said, test them 4 or 5 days after they get back, and if it's negative, then you can go back to normal.
All right. When multiple vaccines are available, would a person vaccinated with more than one drug company's vaccine achieve a higher level of protection than if they were only vaccinated with a single vaccine?
This is another really good question. We do not have an answer. The vaccines elicit an antibody or an immune response, a T-cell response, that each one is a little bit different. And theoretically, having 2 different vaccines, like we do with streptococcal pneumonia, actually is better. Now, you have to be careful, because you're going to have all these antibodies that cross-react, and a second vaccine may be toxic. So I don't suggest anybody just do this. Wait until the studies are done.
All right, Dr. Murphy, thanks for being with us again. If you have a question for the doctor, you can post it on our Morning News Facebook page. Thanks again.
Thanks, doctor.